Listen to this. If you have a health crisis that sends you to the emergency room this year, there's now one less thing to worry about. The No Surprise Act prohibits surprise medical bills when you are treated by out-of-network medical professionals as part of your emergency care. It went into effect on Saturday with the start of the new year. Chuck Bell with Consumer Reports joins us. He's been breaking it down. Good morning to you, Chuck.
Good morning.
So I know that Consumer Reports collected hundreds of stories about surprise medical bills from patients. A lot of our viewers have been there. They have been hit with thousands of dollars, potentially tens of thousands of dollars, and really not known where to go next. Here's the question. What changes should we expect when it comes to medical bills now at the start of 2022?
Well, this has been a big problem all across the country, and the federal government estimates there'll be 10 million surprise bills sent this year. But the good news is we have a strong federal law called the No Surprises Act that protects patients against getting an out-of-network surprise bill in the emergency room or for a scheduled hospital procedure. So this is a huge step forward. And even though some states like Florida had passed some consumer protections back in 2016, in your case, this law makes the protections much stronger because it applies to consumers all across the country, including plans that are not even regulated by state government. So it's a huge step forward for patients, and we really want people to take advantage of their rights.
So while the new ban will protect consumers from hospitals and physicians sending out surprise bills, it does not include ambulances. Why were ambulances excluded here?
Well, so air ambulances are included, so helicopters and aircraft, but ground ambulances, unfortunately, there's a lot more local aspect to that issue because there's many local EMS providers. In Florida, you do have a protection. You're one of 10 states with a protection against surprise bills for ground ambulances. So that's not to say you'll never receive it, but you're somewhat better protected than many other states. But these protections are extremely comprehensive, and the ER bills, it's estimated that 1 out of 5 emergency room visits previously resulted in a surprise bill. So this year, consumers should have a much better experience. You would only be responsible for your in-network cost sharing. Even if you go to an out-of-network hospital, you're only going to be responsible for your deductible, copay, and coinsurance costs.
Yeah, and certainly, Chuck, that can be a big relief. Many of our viewers might remember our recent I-Team investigation into how one Flagler County mother received a $26,000 bill after her son was flown to the hospital in Daytona Beach. That was after her insurance paid $16 grand. So you talked about this. Air ambulances are now included. So if you are in a very serious situation where you or a loved one has to go by air, that is different than the traditional ground ambulance.
Absolutely, and that's a huge big deal. This is why we have insurance to begin with, to protect us against catastrophic costs that we can't bear on our own. And so this law gets the patient out of the middle of the financial dispute. The insurer and the air ambulance company are going to have to go outside and work this out on their own, and the patient's not going to have to be part of that argument. You're only going to be responsible for in-network cost sharing. And if you run into a problem, complain to the federal government. They set up a hotline that's open 12 hours a day at cms.gov/no surprises, and you can file a complaint if you run into any problems.
Hey, great information there. Chuck Bell with Consumer Reports. We appreciate your time this morning.
Thank you so much.